In this episode, we'll look at fetal blood circulation. Fetal blood circulation uses the mother's placenta to supply oxygen and nutrients while bypassing the fetus's inactive lungs and liver. Now, this specialized system relies on three unique shunts. Number one is the ductus venosus, which shunts blood from the liver. The second one is foramen ovale, which is a hole between the right and left atrium. And the third one is the ductus arteriosus, which is a connection between the pulmonary artery and aorta, which redirect blood directly to vital organs like the brain. The way blood flows in an adult person or in postnatal life is different from the way blood flows in a fetus. The whole process starts when oxygenated, nutrient-rich blood travels from the mother's placenta to the fetus through the umbilical vein. The umbilical vein carries this oxygenated blood to the liver. Now, because the liver is still developing, the ductus venosus act as a shunt, allowing about half of this blood to bypass the liver and go straight to the inferior vena cava. So the reason why blood is bypassing the liver, it is because the liver is still immature. So that's the reason why half of this blood from the umbilical vein will bypass the liver and to go into the inferior vena cava. Now, blood enters the right atrium from the inferior vena cava of the heart. Now, to bypass the fluid-filled, non-functioning lungs, most of this blood is shunted directly into the left atrium through the foramen ovale, which is a hole between the right and left atrium. So we find that in utero, the lungs are non-functional. The fetus doesn't breathe in utero. So there is no point of blood going to the lungs for oxygenation. No, this blood that is coming to the fetal body, it has oxygen already from the mother. So to bypass the fluid-filled, non-functioning lungs, most of this blood will be shunted directly into the left atria of the heart through the foramen ovale, which is a hole between the right and left atrium. From there, it is pumped into the left ventricle and aorta and directed to all parts of the body, the vital organs like the brain, the upper body, and so on. Now, the other issue is that blood returning from the upper body, to the right atria may bypass the foramen ovale, which is a hole between the right and left atria, and enter the right ventricle heading towards the lungs. Remember, most of the blood in the right atria moves from the right atria into the left atria, passing through the foramen ovale. But we find that some small amount of blood will still proceed from the right atria into the right ventricle and heading toward the lungs. Now, because the lungs are not expanded, the high pressure in the lungs shunt most of this blood away from the lungs and into the aorta, passing through the ductus arteriosus, which is a connection between the pulmonary artery and aorta. So the blood that is pumped into the right ventricle from the right atria to go to the lungs, we see that a small of blood, yes, will reach the lungs for maturation purposes of the lungs, because even the lungs need oxygenated blood, just scanty or few oxygenated blood for maturation purposes. So the blood that goes into the right ventricle and into the pulmonary arteries, most of this blood will be shunted into the aorta through the ductus arteriosus, which is a connection between the pulmonary artery and the aorta. And this blood which goes into the aorta will be supplied to all parts of the body. Now, deoxygenated waste-rich blood travels down the aorta and leaves the fetus through two umbilical arteries, which retain the blood to the placenta to be filtered by the mother's body. When the baby takes their first breath and the umbilical cord is cut, the circulatory system immediately shifts. The lungs expand, reducing the pressure in the chest, which forces the foramen ovale to close. The three temporary shunt, that is the ductus venosus, the ductus arteriosus, and the foramen ovale, close and slowly turn into ligament, establishing the standard adult circulatory loop. So this is how blood flows through the fetus.